Namaste, myself Dr. Soumya Hullannavar. I'm a lead specialist at EliteAyurveda. I'm over here today to talk on a topic, how diabetes impacts mental health. So many does already know what is diabetes, and I have also spoke on how does the type 1, type 2, how does your medication dosage increases or how does it impacts. So today I'm going to tell you how diabetes impacts your mental health. So as we all know, the fast urbanization has happened in the few decades, and advanced way of life has run us a sensational ascent in our lifestyle diseases in this ongoing decades. So diabetes and stress issues perceived as a developing danger. Yet the more significant part of us considers them to be incredibly discrete issues. So as we learn more through examinations and reports, it becomes evident that diabetes and stress issues are regularly associated. So while the mental pressure is not actual reason for the diabetes, but it builds the danger of that eternal matters, including diabetes. I would say like an endless loop from multiple points of view. Like diabetes also expands sentiments of stress and nervousness due to its immense, I would say like personal satisfaction as well. So mental health influences numerous parts of our daily life. How you think and feel, or how do you handle your pressure, identify the others and settle down on that particular decisions. You can perceive how having an emotional wellness issues could make it harder to adhere to your diabetes care plan. So I'm going to just brief you like how mind-body connection and how does the depression, it's more than a bad mood. So I'll just brief you how does your mental health gets affected. So let's say like your thoughts, emotions, convictions and all the mentalities can influence how healthy your body is. So when we if it is untreated, psychological well-being issues can aggravate your diabetes, and the problems with diabetes can make mental health issues worse. So I could also say like both are interdependent kind. So but if one can start improvising their mental health, this mind and body connection what I'm talking, then the difference will generally shows the signs of improvement as well. So let's say like depression, many people think it's just a bad mood. No, it's more than a bad mood. So depression is like that's a clinical element that causes sentiments of trouble and regularly lost enthusiasm for exercises you used to appreciate. So as you all know, in diabetes the exercise is also one of the key part or a key for the particular treatment to help you. So when you are into a depression, it can impede how well you work at your work and home, including that dealing with your diabetes. So at the point when you can't deal with your diabetes well, your hazards goes up for diabetes entanglements like coronary illness and a nerve harm or anything I have already explained about which could lead you into diabetic complications. It's also observed that the individuals with diabetes, or let's say like twice or multiple times bound to have the sorrow than the individual without diabetes. So you can say just maybe 25% to half of the individuals with diabetes who have misery get analyzed and treated. That's really unfortunate to say that. But still the treatment, the medications, or both treatment and medications is generally that has to be compelling. So without treatment, the gloomy regular deteriorates and it ends up with the worse situations as well. So the people will also be confused, how do I know that I am in a misery, the diabetic patients. So I would say the misery cannot be it varies from individual to individual. That could be very mild to severe. Let's say you're feeling kind of a pitiful or void, or losing that enthusiasm for most loud exercises. For example, some people would love to do some breathing exercises, anulom vilom. Some people would love to do maybe just a walking, a cardio, but you will start losing enthusiasm towards the exercises you used to love it, or maybe overeating or not having any desire to eat by any means. For example, you had to follow the diet in diabetes, but still you will start overeating, end up in overeating, or not having the option to rest, or dosing excessively, having inconveniences of focusing or decision making capabilities, feeling tired, sad, or maybe having throbs or kind of a migraine, spasm, or stomach related issues also sometimes. See, I agree. There are people, like if the sugar levels have increased, then also you may feel drowsy in the afternoons or maybe post food and all, and your hunger pangs can increase. But there are people who have a very controlled sugar values, still they are experiencing these things. Then you have to understand this is something to do with your mental health. It's not only the diabetes is playing, because insulin is also a hormone, so it definitely affects the other hormones of your body as well. So let's say like stress and anxiety. So stress is a very part of the life. Everybody will have to go through it. Maybe anything, that from a family till the work, everything. And sometimes your family requests to ordinary diabetes care. Like some people at home make sure like you cannot have this and all. That could also cause stress inside you. So you can feel worried as for feeling kind of an example that you feel like a physical response or sweating suddenly. So you will get that anxiety attacks. So we say panic attacks. Somebody tells you like not to eat this or don't sleep, then you suddenly feel like you just can't control your anger. So that you have to understand that is something related to your stress level, and which is inducing anxiety, in turn related to your diabetes care. So in case if you are focused on, you may not take a significant consideration of yourself, like your glucose levels can influence as well. So stress hormones makes glucose rise or maybe fall at any part of the day, like any time of the day also. And worry from being debilitated or harmed can cause your glucose to go up as well. It can just shoot up like that. So without having any change in your diet. Then also you have to understand what kind of stress you are actually dealing with. So being concerned for quite a while can prompt the other medical issues or maybe exacerbate them in that particular specifically. Some studies has also shown that treatment for your nervousness usually works superior to medications, but yes, sometimes you may need both together, medication as well as treating up your nervousness also. Or you can also help bring down your pressure and uneasiness just by adopting getting dynamic kind, you can start with a brisk walk yourself, can be like which you feel calm. So you don't like to do it, but you have to push yourself to go for that, and that impact can keep going for considerable length of time, like till you feel calm down. You can just keep walking. So you would have seen some people would love to run when they're really in anger, till you calm down, so that you have a diversion of your thoughts. So maybe doing some unwinding works out, like maybe similar to a reflection, or maybe any yoga stuff, any particular postures, or maybe talking to somebody, or messaging up, or indulging yourself in a chat with any companion who gets you, who understands you actually. So grabbing yourself some me time, we say, enjoy that you have to, whatever you are doing, you just have to enjoy it and just your head out kind. Or maybe you can also have a coffee, or some people are very okay to have that particular sweet, or they crave for it. So if you want to control your nervousness at that particular time, you can have one coffee, and then you have to make sure that you are relaxed, because some people will get relaxed immediately with some habits which they have since the beginning. You can do that, but this all should calm down your nervousness. Then only your sugar or diabetes values can also be taken care. So tensions can feel like low glucose as well. So that is where you have to understand, when you are really having a panic attack but you are feeling like I'm going low because my sugar levels may be low, you can just immediately get checked yourself, and then accordingly you will understand that was something to do with my stress or anxiety, or it was really my diabetes sugar levels were going down. So maybe it is nothing wrong if you would really want to take up any counselor help, or you can just go and meet up a person whom you can really share with. Any guide or any professional's help I think that would be more helpful than just switching on to any kind of anti-anxiety or antidepressant pills as well. So let me just brief you on diabetes and distress as well. So you have been making a decent attempt, however not getting the results. There are patients who says doctor, I'm following everything, the medications, and we also take up their we also check for diabetic complications, and the renal profile, liver profile would be absolutely doing fine, but still they have few kind of stress, anxiety, nervousness. They are not able to control their sugar levels, but they don't have any other symptoms. So then you have to understand that is diabetes distress, what I said. So diabetes trouble can look like a discouragement or uneasiness as well, yet it can't be dealt with successfully medications. Instead, these only following up the medications, you can also follow few methodologies. For example, you have to make sure definitely your expert doctor, whomever you are consulting for, who have a complete idea about your history, how did you start and what was your dosage. You have to be definitely in touch with them, and you have to keep having that customer specialist kind. You have to take up the suggestions at least monthly twice, and you have to talk to them like what all changes you can adopt, and then you can wait for the review again. And you have to make sure you are meeting up your counselor very frequently, make up a meeting with them, because your psychological wellness or the advisor who spends significant time, they can also take care of your well-being conditions. You can also focus on couple kind of a little diabetes board objectives. Instead of suspecting, you need to take a shot everything at the same time. So you can also try joining up any diabetes members group, so that you will also understand is there anybody else who is suffering with the same thing. So you feel that contemplations kind, and that sentiments to connect the individuals, which gives you similar concerns, and you can also gain from them how did they came out of it. So these all could also help you with the distress, to take care of your diabetes distress. So this is all about diabetes and mental health. So you have to make sure it's not only the diabetes which affects you. If your mental health is not really helping you out, then controlling your diabetes is also not as easy you think. And don't keep blaming only the medications, or just changing or switching on the medications could help you. You have to address the root cause. If your mental health well-being is good, then your diabetes is more easy to be taken care. Thank you.